News First, Newsline with Faraz Shauketaly.
And a very good evening to you and welcome to Newsline Live. We're broadcasting as we almost always do from the News First studios in Dawson Street in Colombo. And our guest today is the President of the Sri Lanka Medical Association, Dr. Padma Gunaratne. We hope to ask her all the questions that are wanting answers. So here we go. Very good evening to you, Dr. Gunaratne.
Good evening, Pastor.
Thank you for being on our program. And straight away I'd like to ask you, is COVID-19 now airborne?
Yes, there's no way that we could say no, because the scientific research has found evidence to say that it could be possible. So one has to keep in mind that both these ways, airborne as well as the droplet spread, they both are possible routes of spread.
And is it possible to say, once somebody is diagnosed as being CV-19 positive, is it possible to say how that was contracted, whether it was an airborne matter or was it hands or whatever?
No, it's not possible. By looking at a patient, it would not be possible for us to say that how he contracted, but then contacts one could trace. I mean, contacts, if we carefully trace that from where he got it, because all the time one contracts the disease from another human. So there has to be another human with the...
So you should be able to trace that.
Trace, yes.
Why is it, Dr. Gunaratne, why don't we in this country have an app that will help the tracing and the tracking process?
I think initially they were in the process of developing it, but then as we achieved the control, that the interest, I think, with the interest sort of died down, and probably that now, as we have another surge, they might come up with, because now it has become so important for, I'm
surprised that a budding entrepreneur, a techie entrepreneur, hasn't come up with this and offered it to the government.
I'm sure that they had this app. They used it, but then towards latter part, because that we were achieving some control, I do not know whether they really stopped using it. Many things are there that you and I are not aware. So sometimes if we ask carefully, if we ask the EPID unit, they may still be using it, but it's not there. It's not anything that is needed for general public, but it's for the people who do contact tracing. So I think sometimes they may still be using it.
And but I think what I meant was whether why isn't it not widely available and being used by the public?
The contact tracing, I think, but that is what I meant, that contact tracing is a job of the administrators or the healthcare professionals. So actually the app would be more useful for them, I feel, that more than for the general public.
Now, Dr. Gunaratne, we've seen in the last several days that the figures have gone up.
Yes, escalating.
Why has it gone up?
It's because that, if you think of towards the December 2020, there was a little increase in the number of cases, along with the behavior of the Christmas celebrations. But then towards January, February, we were able to achieve control and the numbers really went down. But if you check the numbers or the positivity rates towards end of March and then early April, and immediately after the New Year celebrations, there is a sort of a rapid rise of the positivity rates that are given from laboratories. So definitely this follows the behavior of people for the New Year shopping, New Year celebrations, visiting relations and gatherings, and I think that's what that was responsible for this what we assume as the third wave.
But Dr. Gunaratne, would it be fair if I put it to you that the authorities have been rather lax or rather wide-angled in their tolerance, in their advisories, rather than taking a harsh step and say, look, no celebrations, nothing. You will stay inside and that's about it, because the bigger picture is far more important than celebrating New Year or Christmas or Easter or whatever.
What you say is true. There was so much of health warnings, particularly from the epidemiology unit of the Ministry of Health, and particularly from many health professionals with regard to adhering to public health measures. But then the public behavior is very peculiar. You see that unless there is sort of a threatening, unless there is very clear evidence for them, they tend to relax, and that their behavior becomes totally unacceptable and very much ignorant. So this is the consequence of the behavior of the ordinary public, that who were very much callous. So I think that that is how the public is. So there's not much of point in you and me doing a lot of postmortems, but what is needed today is to adhere to public health measures, and then for the government to implement more strict laws, particularly with regard to movement of people.
That's true. Postmortems are not so helpful, but there are positive benefits of postmortems, because we hopefully can learn.
Yes.
Honestly, there must be a limit to the number of times that we have the health professionals and the army commander in his capacity, the head of the committee, and so on. There must be a limit to the number of times that the public can be warned of the serious, dire consequences. And it appears, nevertheless, if you saw the pictures that came from some of the main shopping centers, it was horrendous, because there appeared to be no COVID precautions taken whatsoever.
Yeah, I think what you say is very correct, because that is, when the regulations become important, and laws, the implementation of the laws already, that was in existence, was important. So this is the behavior of people that one has to all the time expect, and we need to act, I think, based on that assumption.
And if we, I know it's sometimes people say it's not helpful, but just to understand it, you know, back in 2020 when it first started, there was hardly any celebration at that New Year. New Year 2020 was a really horrible period. And do you think that come 21 that the authorities took this view and said, well, we must give them a bit of a chance because 2020 was so bad? But isn't that short-termist?
I think that's, that's one way that they would have thought of. Particularly, they would have been more concerned of the economy and the small-scale industry. There are people who were so much economically affected, so that they wanted to give them an opportunity, I feel. So there are many aspects for this problem that we need to take into account.
Is it true that we are struggling now? With the increased numbers and so on? Are we struggling?
We are in the verge of struggle, because that the system, particularly with regard to the COVID beds, more than for beds, the COVID ICU beds are sort of getting almost full in almost.
Have you got any numbers, Dr. Gunaratne?
I'm sorry, I'm not with numbers. No, I'm not.
Because we at the beginning, when this all started, I remember doing a program in which we said it was about 120 beds, but then we know that the Americans gave us about 200 and various private donations and so on. But nevertheless, how are the hospitals doing? Are they full or getting full? Where are we there?
As per information that I gather from the many of our colleagues and the members of the association, several of the hospitals, particularly in Colombo region, are full too. but then still at manageable level, so that there is a need for us to sort of rapidly increase the availability of beds, because I mean, to accommodate the patients, particularly in this wave, that we see more patients who are with symptoms and who need more oxygen, and then as well as the complications, and so that more with the ICU needs.
Are there any, sorry,
particularly with this particular variant that we see more. I mean, previously during the last first and second waves, it was only about 20% that were with symptoms. Now it appears that more are with symptoms, and more become serious, and serious to an extent that they need oxygen.
Two questions arise. One is, are the numbers up because the testing numbers are up?
Not really, because the Ministry of Health never stopped testing. But if you take the rates per 100 tests, I mean, the number per 100 tests was much lower during February and early March and so on, and it's more towards the end of March and April, and now that per 100 that the numbers have gone up. So it's not testing less that I mean, sort of gave us the impression that there were no cases.
So the testing is as intense as ever, if not more?
I mean, now I think that they have intensified testing, but then there was no need for them to intense the testing in February and early March, because the numbers were low. I mean, say even if they intensified the test, the rates were low, positivity rates were low.
So the per 100 rates were low?
Yes.
And can we put a finger on it and say, this is why it's gone up? Or is it general? Is it because of the movement of people and so on?
It's because of two reasons. One is that the movement of people and gatherings and sort of more spread, the behavior of community. And the other is that it's thought that there is a new variant which is with more transmissibility, so that one person once infected tend to give the disease to so many others, because that there is higher transmissibility of the infection. So that's why people need to be more, I mean, sort of need to be more concerned than even before with regard to contracting the disease.
And Dr. Gunaratne, is it fair or unfair to say that there's a lot of theories, but practical matters are not being implemented?
Such as?
There are lots of theories say, well, you know, you need to keep people mustn't travel. So that's a theory. The implementation part is for somebody to say, well, you know what, we're going to close that road, and from Friday night or whatever it is, we're not going to let anyone out. That's the implementation part. I'm just taking one little thing. Then when you say, well, you know, we mustn't have parties or gatherings, and then you get this other little thing saying, oh, well, you can do 50, or you can do 10, or 100, 150, or whatever. But there's always a way out. So that's where there's this lacuna in the implementation process. And so I'm wondering whether the theoreticians are having a field day and the implementers are saying, well, you know what, we don't have the money, we don't have this, or we don't have that, or something, and they're not able to implement. So where's the balance? Is the theoreticians up there and the implementation down, or whichever way it is?
It's very difficult to say who is up and who is down. But then what you say, there are two aspects of what you say, because the essentials essential needs of people anyway have to be continued, maintained. So the electricity, food chain, water, and all these anyway have to be maintained. So there will be anyway a set of people, healthcare professionals, that who anyway will have to be exempted, and they anyway will have to work to maintain the services. And at the same time, there are others that, there are certain places that where you could make it little bit more strict to reduce the numbers of gatherings. So what there is, I mean, there is two sides. I mean, that is what we need to balance it very carefully.
Yes, because there's the need
to
of the economy.
That's
as well.
right. That's right. So see, in a way that we achieve the maximum control of the infection.
And Dr. Gunaratne, is it unfair to compare the success story that is Israel? Israel has completed their this herd. What did you call? How do you call it? The herd method, if you like. But one of the interesting things that I read was that the Israeli government paid double long before the vaccine was actually commercially available. They paid double, and they also did a sort of deal, if you like, where they told the company that was producing it, look, we'll even give you the results of, you know, the sort of research part of it. And of course, if our politicians in this country had paid double for anything, you can bet your bottom dollar or rupee or cent that we'd all come down hard on them and say, oh, hello, why have you done that?
Yes.
But the Israeli Prime Minister said that, look, if we shut our economy down for 3 days, the cost of paying double is nothing in comparison to shutting the economy down for 3 days. That was only 3 days. In Sri Lanka, we shut our economy for several weeks. Is it unfair to compare Israel?
I generally feel that it's unfair to compare with any other country, because we Sri Lankans are Sri Lankans. So I don't think, I mean, there are many countries that have achieved control. New Zealand, Australia, there are many other countries, I mean, they haven't paid double, but then still they have achieved control, you see. So I mean, what is important is not what people would say, but the outcome.
Yeah, the results.
That's right.
But right now, the results are, to say the least, frightening.
That's right, yes.
Because we are all aware
That's right.
as to how fragile our health services.
Yes, true. That's right. That's right.
And especially in rural areas and so on.
That's right, yes.
Is it...
and particularly with regard to acquiring vaccines, that we haven't been that all right.
And that is the other question.
Yes.
How are we doing when it comes to the second dose?
Now actually the Ministry of Health started vaccinating healthcare professionals initially. So their second dose was due on 28th of April or so. So and now we are a little confident that it's possible for us to vaccinate or to give the second dose for healthcare professionals. So from tomorrow that they are going to start vaccinating healthcare professionals.
Do we have numbers? How many vaccines are available right now?
I'm sorry that I do not have exact numbers, but then I assume about, I mean, for my information, it's about maybe 350,000 vials or so.
So what about people like me? My date is the 2nd of May. I think that's what it said on the card.
Yes.
Let's see. I think it said 2nd of May. Yeah, it did actually, 2nd of May.
Yes.
Do you think I'll have I'll sort of have a chance to get my second dose?
It's difficult for me to say. Actually, it's something that we have to, I mean, that's a place that where we have to gather information from State Pharmaceutical Corporation whether the vaccine would be available to be given to all public that who received the vaccine.
Now, Doctor, we read in the international press and so on that AstraZeneca is having all sorts of trouble. They're being sued for lack of delivery and so on. What does this mean for the bulk of us who've got it? We've had the AstraZeneca one. Does this mean that if the 200,000 Sputnik 5 comes in here, that we can mix and match, or how's the scientific evidence there?
The problem with AstraZeneca is blood clotting, isn't it? The blood clotting, of course, is a sort of a rare side effect. I mean, one anyway would not expect even a rarest to get that side effect, because that we vaccinate a normal person. But then the WHO has clearly stated that the benefits outweigh the adverse effects of this vaccine.
Right.
So I think that I would encourage all healthcare professionals who would be, who would be commencing getting their vaccination from tomorrow, to go for the vaccine and to get it. Now, for other public, hopefully that the government would be successful. I feel that acquiring the stocks of AstraZeneca, probably. I actually do not know. But then with regard to mixing vaccines,
yes,
there isn't much of data to support mixing. There are sort of there are two schools of thought. Some tend to think that if you mix that, you would get a better immunity, whereas some others, majority, would think that it shouldn't be done. Particularly the CDC Atlanta has warned against mixing unless it's really unavoidable. See, I think that the developed nations such as the France and Germany recommended mixing. I mean, they recommended mixing with the second dose with Pfizer, because that they could afford and they have the access, and particularly for young and for women that who are more vulnerable for blood clots, they recommended Pfizer. But then in our setting, I don't think that there is any evidence of mixing with Sputnik 5.
And thank you very much for all the questions that are coming in by WhatsApp and SMS. 0772 300 305. One question that is being repeated many times tonight is people are asking, what about this new variant, this airborne business? Is there any additional precautions to take?
Whether it is the old version or the new variant, it is you contract the disease either by droplet or airborne. So it is a respiratory infection. So what you get is fever, sore throat and cough, and then when it further exacerbated, you may end up with pneumonia. So once you get into that state, you may become short of breath and chest pain, and along with any fever that you may get, the body aches and pain, headache, tummy pain, joint pain, and so on. So that, I mean, the set of symptoms, whether it is old or new, there isn't much of a difference. But then with the new variety, you see that more transmissibility, more tend to get affected more easily, or you may become get into that pneumonia state, and one may present even with shortness of breath with pneumonia without sore throat. And more young tend to get affected with this new variant.
Yes. So is there anything, should people now wear 2 masks instead of 1, for example?
I don't think that there is much of an evidence for that 2 masks. Definitely there is no evidence for, I mean, what is recommended for people community is surgical masks, and there is no evidence for using 2 surgical masks. The surgical masks are not made for that purpose. So if one is really anxious, what one has to wear is a cloth mask and a surgical mask.
Yes, I have seen some medical professionals in the hospital wearing 2 masks.
Yes.
I thought we'd ask about that. Now, another concern was that there are sort of fake masks going on. How do you tell the difference between a proper mask and a fake mask?
I think it's a bit difficult by looking at it, unless the quality control is done by the experts in the field. By looking at it, it would be difficult for ordinary people. So there has to be sort of quality control.
We hope that people are being conscious of that and not misleading the public.
Yes, definitely, yes. I think definitely, yes.
Because if someone's caught, I think the Consumer Affairs Authority needs to come down hard on them.
Yes, that's right. Yes, definitely, because
they are risking our limited resources, and after all, Sri Lanka is a poor country.
Yes, exactly.
Somebody's asking what's happened to... Well, here you go. The public transport, buses were overcrowded. Somebody's even giving us the routing and so on. I myself just a bit earlier saw a train going towards the south off Marine Drive. It was full. It was, okay, it was going too fast for me to count how many people may not have been wearing the mask. But yes, most probably they've all been wearing masks, but they're all not packed, but yes, it was crowded.
Yes.
How does one deal with this?
I think that this is a very special situation. It's not possible for government to provide each and everything for all individuals in a way that we stop spread among us. So I think that each and every individual individually have to be responsible, and then we need to take our own precautions, and I mean, we need to make use of whatever the provisions that have been allowed. Say if government allows us to work from home, then yes, certainly we do work from home, and then we avoid crowded places like the fair, the market and so on. And then for buses, I mean, maybe that one could avoid those peak hours, and so then to see whether you could, and then to go for work less often. So
the inconvenience is actually your investment in safety.
Exactly, yes, yes. That's how we need to think of.
Yes. So you're going to have to bite the bullet and take the next train, which may be in 30 minutes or 45 minutes later. But what to do, as they say in Sri Lanka.
That's right. That's right. So this is the place where we live.
Exactly.
And then
so it's your investment.
That's right. Yeah. Yes. Yes.
Maybe you can get your pressure up by telling off the politicians in your mind. But maybe you want to bear all of that in mind when it comes to D-Day, voting day. But that's you know, that's human nature. You need to get this. You need to get the steam out.
Yes, true.
And so you can sit nearby to somebody and bemoan the fact that nothing's happening. And why is this blessed train taking 45 minutes?
And that's right. Yes.
But what's the alternative? In Japan, they push you into the trains.
Yes.
So it'd be interesting to see how they're getting on.
Yes.
Now then, what? Okay, here we go. Somebody's asking us: are you convinced that the government is being advised properly on this matter?
It's a difficult question for me to answer because that we are not. I mean, we do not have any first-hand information. So I think that as an association, we are a little concerned, and then we also try our best to say that, I mean, we have already informed the government of our feeling that the threat, I mean, the impending threat of the third wave. So it is a place that where we all have to be concerned, and then we hope that the Ministry of Health, I mean, that has all the sort of responsibility of controlling the outbreak, probably because that they have the task force, the presidential task force, that where they meet every week, so that we believe that they must be communicating the correct facts.
So as we end the program, Dr. Gunaratne, would you agree when I say that everything else last, health first?
I think yes, because I mean, what is most important is health. I mean, if one's health is gone, there is no value of anything else. Yes.
Dr. Padma Gunaratne, thank you very much for being on the program. It's been interesting listening to you, and especially your concerns. And there we go.
Thank you very much for the opportunity.
Thank you. It's a great pleasure, and that's the way it was on Newsline Live. Remember, the basics, you need to do that. Mask, hands, wash, and the distance. On that note, take care, and God bless you.